Hypertension Awareness Series Episode 11. Good morning. Today we learn about hypertension in the youth and young adult population. In our last episode about hypertension in Africa and Kenya, we uncovered a deeply concerning reality. High blood pressure in Africa occurs at a much younger age than in any other parts of the world. Here in Kenya, hypertension is now being diagnosed in people as young as 20, in their 30s and early 40s, and many are completely unaware they have it. Complications are now occurring earlier and more aggressively in the young adult population. Hypertension is no longer a disease of the old age. This week in the clinic alone, the majority of the patients I saw with hypertension were in their 30s and 40s. These are not elderly people. These are young people, young professionals, parents, working adults, and many are shocked by their diagnosis. Many also find it hard to accept the diagnosis. Hypertension is now affecting people in their most productive years. And this is why this is a very important episode, both to the general population and to the healthcare providers. Why is hypertension rising in the young? Always, number one, always think of secondary causes in the young. Hypertension in the young adults is not always essential or primary. Secondary hypertension is the most common cause of hypertension in the young, and it must be actively looked for. Important causes in the young include kidney disease like glomerulonephritis, hormonal disorders, thyroid disorders, adrenal disorders, excess aldosterone. There is also narrowing of the kidney arteries, obstructive sleep apnea, certain medication supplements, and also recreational drugs are a common cause of hypertension in the young. Red flags that should trigger deeper evaluation includes very high BP at young age, sudden onset hypertension, BP that is difficult to control, early signs of organ damage. Identifying a secondary cause can sometimes reverse hypertension and avoid lifelong medication. But number two, not all hypertension in the young is associated with secondary causes. Modern lifestyles are also driving this disease. High salt, ultra-processed foods, energy drinks, sugary beverages, sedentary living, inactive lifestyles, rising prevalence of overweight and obesity, smoking, alcohol use, poor sleep, chronic stress, lifestyle factors that raise blood pressure in the young people. So remember, it's not every hypertension in the young is due to secondary causes. There are also lifestyle factors. Why is hypertension in the young a serious problem? Remember, hypertension have no symptoms, so it is usually missed. Most of the young people are healthy. They do not go to hospital, so screening is not done. But early onset hypertension means longer lifetime exposure to high BP. I repeat this, longer lifetime exposure to hypertension, earlier damage to the organs, heart, brain, kidney, much higher lifetime risk of developing heart attack, stroke. Damage begins in your 20s and 30s, but complications occur in your 40s, in your 50s. That's why we are seeing very many people coming with stroke in their 40s, hypertension which was missed. So guidelines now stress, you do not wait for older age. Start screening for hypertension early. Hypertension in the young, screening should be done. Young people with obesity, family history, risk factors need to have screening for hypertension. In the young, you always must screen for secondary causes, and if secondary causes are found, treatment should be done. Early diagnosis, early prevention, early treatment to prevent complications. What can you do for the young adults? Check your BP at least once a year. Know your numbers. If you have a family history, if you have lifestyle risk factors, check your BP. In the family setup, healthy living, healthy diet, exercise, limit sugary drinks, and for everyone, maintain a healthy weight. Be active, sleep well, manage stress well. I conclude by stressing early onset hypertension means longer lifetime exposure to high BP, earlier organ damage, much higher lifetime risk of complications like stroke, heart attack, heart failure. Damage, hypertension being diagnosed in your 20s and 30s means complications will occur in your 50s, in your 40s when you are very productive. And to the healthcare providers, do not ignore hypertension in the young. Assess for cardiovascular risk factors, lifestyle modification, treatment when indicated, and screen for secondary causes. So stay tuned to our next episode where we talk about cardiovascular risk factors. We start with modifiable risk factors that you can do something about. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.